Very good morning, all the students. Is audio video fine? Can you update in the chat box? Is audio video fine, beta? Can we start with the session? Beta? Everyone. So first of all, the NEET examination in the ENT segment, all the questions, what I will say, was from your concise workbook. So in the next couple of minutes, we'll be discussing all the important MCQs, we'll be discussing all the important questions which were there. We'll learn all the important concepts, but a very strong message, beta, is a high time to work on the concise notes. Paper was integrated paper. You can apply all the concepts on the paper questions when only you have revised the things minimum 4 to 5 times, beta, and 4 to 5 times revision will be only possible when we have ultra concise notes, beta. So let us start the game, and all the students who are working for the next INICT examination, try your best to work with the concise notes which are conceptual, which are very crisp, and so that we can revise them multiple times. This should be the motive. Am I understandable? So can we start with the session? Everyone, every student, kindly actively participate. I tried my best to concile all the important topics or MCQs which were there in the last NEET examination. So starting from the first important MCQ, which of the following procedure will be difficult in trachea shown below? So now just try to learn better what examiner want to ask you. Examiner is giving you a slide where he have given you a deviated trachea to one side. So which of the following procedure will be difficult in this? This was a new MCQ, very tricky, very logical. Okay, if trachea is deviated to one side, so beta, obviously if I am doing any procedure, in oropharynx or hypopharynx, it will not be affected. If I am doing anything on the trachea, it will be impaired. Do you agree with me this concept? So let us learn with the important options which were there. Indirect laryngoscopy was the first option they have given you. Yes, anyone, what will be the right answer of this question? Now every student listening to me, reply very confidently. The trachea deviated to one side. So which procedure will be uncomfortable will be obviously if I'm doing operating in the area of trachea now. So out of 4 options, the best option going in the favor of tracheostomy. Indirect laryngoscopy, laryngeal mass, airway, all these things will be somewhere in the oropharynx, oral cavity, hypopharynx, not on the trachea. So the MCQ, the answer will be C option. Clear? Very important topic. Tracheostomy. One option student is writing nasogastric tube. No, beta. Nasogastric, better option will be tracheostomy. In this, the answer will be here C option. Clear? Tracheostomy, very important topic for the upcoming INICT examination. So go with all the important concepts of tracheostomy, high level tracheostomy, low level. They frequently ask you in your central institute. Coming to the next, I am taking the first 2 slides, which was an integrated question of ENT with radiology. So which sign is being shown? So they have shown you, most of the students were saying they have shown you some button battery, they have shown you some coin, and they have asked you which sign is there. So we can attempt this question in 2 different methods. Let us start now. This is somewhere, if they have shown you some, this is not the actual image which I am sharing with you, but they have shown you something, 2 rings were there. So if the examiner have shown you 2 rings, it may be more probability the most dangerous foreign body which we have learned in the classroom, that is button battery. Button battery can be the possibility. And if the examiner is showing you button battery, there is a possibility okay, we can appreciate a double ring sign, because in the button battery you have something elevated. Yes or no? Some central ring which is elevated, which is giving a image of second ring. That is the second option. Now now concentrate on the board. Every student, beta, concentrate on the board. All the important concept which we have discussed in the classroom, I am repeating again. Double ring sign, the other way to attempt the same MCQ, rule out the option. What I always say, try to rule out the options. Options were stipple sign, but I always say in the lecture, ये question तो आना ही आना है. Either they will ask you stipple sign group, or they will ask you your epiglottitis, thumb sign. So these options rule out because we have revised in the classroom itself. Stipple sign and thumb sign, they are feature of croup and epiglottitis. String sign in your GI you must have seen in croup, but this option again rule out. Answer will be double ring sign. So here the answer will be double ring sign. I'll be taking all the MCQs from the point of view of the next INICT exam. Button battery, dangerous foreign body in external auditory canal, it can lead to facial palsy. This is an important point. Am I understandable? Clear? If button battery is there, try to remove it as soon as possible. Remove it as soon as possible. Clear? Done. Is this clear? This concept is clear. Coming to the next one. A 13-year-old boy. Whenever I start teaching the topic of pharynx, I always say the pharynx matlab MCQ on angiofibroma have to be there. MCQ have to be there. Clear? So they have shown you some image, endoscopic image. They have given you epistaxis, nasal obstruction. What were the important keywords we have read in our classroom? One is here unilateral epistaxis in young boy, sphenopalatine foramen. Which were the keywords, beta? Focus on the keyword which we have learned in the classroom or live platform. Take my word, on eMedicoz, the live platform, the best platform where we are interacting with the students, where you have a option to raise the query. And take my word, if you ask the query, your mind, you are polishing yourself, beta. So don't believe in that. This paper have proved that rote learning, rectification will not work in the exam, beta. We have to learn the underlying concept. What are the 5-6 keywords we have read? Unilateral epistaxis. Yeah, then beta, we have discussed unilateral epistaxis. One keyword, sphenopalatine foramen. One keyword, Holman-Miller sign. Holman-Miller sign we have discussed is angiofibroma on CT examination. Posterior void. What is Holman-Miller sign? Posterior void, posterior wall of the middle maxillary sinus bending down. Maxillary sinus bending down. If you remember, it is a testosterone dependent tumor, very aggressive tumor. One deformity, that is frog face deformity. And even in DVT we have discussed this point. No biopsy of this topic, only surgery, no biopsy of angiofibroma. These are the important point which we have learned. Must read topic. What he have asked you? He have given you a endoscopic view. They have shown you unilateral epistaxis. Even if you cannot make a diagnosis with the image, unilateral epistaxis, young boy, it is going in the favor of adolescent. Option was there. It is angiofibroma. So which investigation? It will be CT examination. So out of 4 options, biopsy contraindicated, we will not go for. If you have to compare MRI against your CT, it is a vascular tumor, so right option will be your C option. C option will be there. Clear? Again, angiofibroma is very important for upcoming INICT exam. Let us use this platform. Let us use these MCQs to learn the must-read topic of upcoming INICT examination. Angiofibroma, beta, we have 2 important classification. One is Fish classification, very important for Central Institute, or Radonsky classification. So these 2 classifications should be on your tips. Fish classification, Radonsky classification. Beta, it is vascular tumor, so it is better to go with the ITA. Okay, I will rectify the options. CT will be the option. Clear? Done. Radonsky and Fish classification, very important for upcoming INICT examination. They can give you match the following MCQs. Done. After learning this topic, I am taking you to my workbook where we have given this slide. I'm showing you these slides of workbook to give you a message okay, how to utilize these concise notes, beta. This is something, a screenshot of my workbook of ENT, where we have shown on CT examination that tumor is very destructive. It will push the posterior wall down. Am understandable? In ENT, beta, we have 2 important concepts related with posterior wall bending down. Examiner can either ask you Holman-Miller sign or sagging of the external auditory canal. Holman-Miller sign is a feature of Angiofibroma, what we call it as Hallman-Miller. Anybody who can write in the chat box, what is posterior wall of external auditory canal bending down in a patient of mastocytitis? It is a hallmark feature of my patient mastocytitis, suffering from mastocytitis, that is Hallman your sagging of the canal. If the posterior wall bending down, we will call it as sagging of the canal. Sagging of the canal. Is it clear? Done. Coming to the next MCQ. After learning which of the following sinus is blocked in the given image, they have shown you some image and the examiner asks you, okay, which sinus is being blocked. Now I'm taking you to my workbook where we have learned. This is page number 7 on the workbook where we have mentioned opening of all the sinus. And on the same page, we have mentioned this slide where we have explained you, okay, if there is any obstruction, beta, these are the screenshot taken from my workbook, which give you a message, okay, how the line diagrams, how the important concise notes work, how we can revise it multiple times better. Just try to appreciate. On the same page, we have given you this slide where I'm showing you this is the ostium of maxillary sinus, and if examiner have shown you some blockage at this level, it must be the maxillary sinus blockage. Am I understandable? Are you getting this point? Clear? In the middle meatus, in the middle we are having 6 sinus. Out of 6 sinus, your sphenoid sinus open in the supreme meatus. What is the other name of supreme meatus beta? Sphenoethmoidal recess. My posterior ethmoid open in my superior meatus, and 4 openings are there which are in the middle meatus. That is maxillary, that is my ethmoid. Which ethmoid? Middle ethmoid, anterior ethmoid, middle ethmoid, and one is your frontal sinus. Am I understandable? Clear? So these openings, again, a important topic for your NEET examination. So answer should be maxillary sinus. Some students who are telling me that they have mentioned the word osteomeatal complex, then the osteomeatal complex, if instead of maxillary, that will be the better option. But among these options, the answer should be maxillary sinus opening. Clear? Now, taking from this MCQ, I am taking you to the INICT segment. In INICT, beta, what they will be asking you? They will be asking you osteometal depth of osteometal complex. They will be showing you something, this slide, and they will ask you on uncinate bone. So beta, let us write 2 important points for upcoming INICT examination. Uncinate bone. Where is the uncinate bone? Uncinate bone is on the roof of inferior turbinate. Beta, yahan pe. Here will be some uncinate bone. Examiner can show you uncinate bone which protects you all the ostium, and which is the important step in endoscopic surgery. Sometimes we have to break this uncinate bone. So there can be MCQ related with uncinate bone. How to identify uncinate bone? Roof of inferior turbinate. On the roof of inferior turbinate, there will be a projection. That projection will be here, uncinate bone. It is in the middle meatus. I hope you're getting the message bit of uncinate bone. And second, they can ask you something on osteomeatal complex. Osteomeatal complex. The word itself is telling you osteums along with the middle meatus. One very old MCQ. Let us use these questions better to predict, to equate which are the probable MCQs they can ask you in your central institute in the upcoming examination. Basal lamella beta, and there is a bony partition. Just try to appreciate, there is a bony partition between anterior group of air cell and the posterior group, what we call basal lamella. So in examination, if examiner asks you something on basal lamella, very old MCQ, or ground lamella, basal lamella or ground lamella, it is a bony partition which differentiate anterior group of cell from the posterior group, anterior group of cell from the posterior group. Clear? Is it clear? So answer will be maxillary sinus. Now, in the morning shift, there was one MCQ, identify the device shown as below. So they have shown you something like, I'm comparing these devices beta. Laryngeal mask airway is like somewhere like this. Clear? So option A can be ruled out. It was the integrated question of ENT with anesthesia, or it can be nasopharyngeal airway. So this type of curved device is your nasopharyngeal airway. So answer will be in this MCQ, the answer will be C option. Answer will be C option. Okay, one of the student, yes, Dr. Pawan is saying maxillary sinus has very small amount of congestion not reaching into the infundibulum. What the student is writing in the chat box. In its model sinus, there was a complete blockage up to the septum. So I think its model sinus will be the better option. Let us use this slide to learn the important concept better. Now concentrate very nicely. One of the student is saying, okay, the answer should be better ethmoid. So better how to differentiate. Now compare these two maxillary sinus. It is always better to compare the right from the left. If examiner have shown you both the maxillary sinus of same size, there is some radiolucency, clear, there is no air fluid level, we will go in the favor of some other sinus. But if my maxillary sinus is opaque, there is some hypertrophy, mucosal hypertrophy with along with the air fluid level, so it will be going somewhere in the favor of maxillary sinus, somewhere in the favor of maxillary sinus. So but obviously I don't know the actual image which was there in the examination, but now you compare it model from the other side. If both the ith model are of same size and there is a radiolucency, it is better to better not to mark the ith model sinus. So you can compare with the other side beta, because I am not having the actual slide, I will not comment on it, but most of the students what they were saying, okay, the maxillary sinus blockage was there was maxillary sinus blockage, clear, there was maxillary sinus blockage. One second. Let me refresh the system. One second beta. Yes beta, is it visible? Is it visible now? One of the student is saying, sir, the same image which we have discussed in the class was there. So better than the image which we have discussed in the class was going in the favor of maxillary sinus. So I will take it as a right answer. Maxillary sinus will be taken. Now the question number 5, some students were telling they have shown some uncuffed tracheostomy tube. Can you update in the chat box whether they have shown you this type? If they have shown you this type of airway, it is nasopharyngeal airway. And if they have shown you a tracheostomy tube without cuff, which we rarely use, most commonly the tracheostomy tube we are using is your cuffed tracheostomy tube, clear? So if they have shown you a tracheostomy tube without any cuff, that will be the uncuffed tracheostomy tube, which have a high risk of ear aspiration. Am I understandable? So one of the student is saying they have asked you a question on tracheostomy. So for Central Institute, the important point, tracheostomy is of 3 types beta: cuffed, uncuffed and fenestrated tube. What my patients say, bolne wali tube. Fenestrated tube is mainly used for voice. Your cuff tube, can you update in the chat box, all the students listening to me? Was the MCQ on the tracheostomy tube, or they have asked you nasopharyngeal airway? Cuff tube, they always reduce aspiration, they always keep the tube in position. But drawback of cuff tube is pressure necrosis. This is the drawback of the tube. It causes pressure necrosis of the trachea. Done. Same image was there. So if the same image is there, answer is going in the favor of nasopharyngeal airway. Done. Clear? Cuff tube, AIMS people can ask you, Central Institute, they can ask you either more, they are more interested for the fenestrated tube actually. It is used for voice. And cuff tube, they can ask you how frequently we have to deflate the cuff. So beta, all students remember, it is every 2 hourly we have to deflate the cuff for 5 minutes. And important concept, we should keep low pressure, high volume in this cuff tube to prevent pressure necrosis of the trachea. Clear? Coming to the next one, a patient with a history of ear discharge on otoscopic examination, perforation seen in the anteroinferior segment. Comment on the Rennie's finding. So beta, if examiner have shown you, I will say this is the easiest MCQ anybody can ask in the NEET exam. On the very first day after discussing MCQs, every student was saying that the paper was on moderate to tough. Paper was on the tougher side. But honestly, beta, all the MCQs, if you are discussing with me, they were simple, basic. If you remember the last 2 years question on Rennie's and Weber, they were very difficult. But now they have asked a simple question. Tympanic membrane perforated. It is conductive deafness. My external ear, middle ear involved. If you remember, we have learned this type of flow chart in the class. This is my ear conduction. This is cochlea. This is the area behind cochlea, that is retrocochlea, 8th nerve and brain. And what is, if you remember, I'm taking you to my class where we have discussed ear conduction is external ear, middle ear. And when external ear, middle ear involved, it is my conductive deafness. And if it is conductive deafness, it will be Rennie's negative. I will say it is one of the easiest MCQ in the exam. Clear? We cannot say this is difficult. This is one of the basic but the easiest question anybody can ask you on the Rennie's or Weber. Now I am taking you to my workbook where we have discussed all the Rennie's positive, Rennie's negative. And why I'm showing you the slide, just remember beta, we have discussed this point twice in the workbook, and I highlight this point. Okay, Rennie's positive, amplification positive, AC is better than BC, is normal, sensory and neural. I'm showing you few images from the workbook. On our workbook page number 91, we have discussed, we have fill up this blank. Now when you are sitting on the live platform or in the classroom and you're filling all these blanks beta, it helps you in a fast revision. Rennie's negative means BC is better than AC, is conductive deafness. Now why I'm showing you this slide, on page number 91 we make our student revise Rennie's positive. On 93 again I ask my students to better fill, because this is a important topic. Examiner will definitely ask you a question on Rennie's or Weber. Rennie's AC better than BC, normal human being. Conductive deafness, it is Rennie's negative, here it is positive. So the MCQ from, why I'm showing you this slide, to boost up your confidence beta, concise notes is the key to success. Those students who couldn't perform well in this exam, make a promise, we will go with the concise notes. We will not ratify, we will not mug up, we will learn the concept. If you have learned the concept of air conduction, bone conduction, what is Rennie's positive means there is air conduction dominating on bone conduction. Rennie's negative means bone conduction dominating on air conduction. What is Weber? In normal human being, it will be centralized. In conductive deafness, it will be lateralized to disease ear. Why? Worse ear. Why? Because no disturbance coming from outside. So conductive patient always feel better. In sensorineural deafness, it will be lateralized to normal ear or better ear. So beta, these are the important concepts they have asked you. One of the easiest question, I will say. Coming to the next one, which cranial nerves are involved in impaired gag reflex? Again, a application of basic anatomy. This is not a difficult question. Here, oropharynx supplied by oropharynx area is related somewhere with the 9th nerve, and the hypopharynx segment is related with your 10th nerve. This is somewhere we have learned. So it is 9 and 10th will be the best option in this question. 9 and 10th will be the best option. Clear? If you remember, we have learned all the cranial nerves in the topic of referred otalgia, where I have taught you anything in the oropharynx will cause pain in the ear because of 9th nerve. Your tonsil, your oropharynx, base of the tonsils, styloid, all these are related with the 9th nerve. And hypopharynx, piriform fossa, larynx, they are somewhere related with your 10th nerve. If there is any issue in the piriform fossa, the part of hypopharynx or larynx, the patient is going to have pain in the ear because of 10th nerve. So these two areas are responsible for gag 9 and 10th nerve will be responsible. Clear? Coming to the next one. This is again a nice question. Identify the part of cochlear implant I've shown, and most of the students are saying that they have asked you somewhere this part. Clear? They have shown you some radiological image and they ask you to identify. Dr. Karthik, thanks for the compliment. Maximum things were from the DVT, concepts given from the DVT. Why I'm showing you, not to say that my strike rate is more than 80-90%, but only a strong message. If we make a concise note, then only we will manage to revise 19 subjects better. Just try to learn the importance of concise subjects. So what, if you remember my words in the class, I'm repeating the words which I always say in my lectures. Or I always ask my student to draw a line diagram except one image which you have to draw 2-3 times, because they will ask you the parts of this image. This is the important thing which I say in my lecture on the workbook, page number 147. We have given this slide which I make my student to write. Okay, this is a plastic coated, which is the external device. This is my transparent internal, and there is a long electrode which is known as micro electrode. Then we draw a simple line diagram how we keep our cochlear implant in scala tympani. I hope if you have attended my lecture, you will have nostalgic feel. Yeah, we have discussed all these points via round window. So this electrode is going there. So out of 4 options, anything which was wire, it is here micro electrode will be the best option. Now, if one of the student, with this the same feedback I'm getting from the other student, there was another wire which was there, but it was on the lower side. So beta, that is a ground wire. You can say this is the main wire which we are taking inside is my electrode array. Electrode array will be the best option. Clear? So this concept going in the favor of implant. This is one of the image based MCQs from the otology. Clear? They have asked you more of the images bit, and be prepared. What I feel as a faculty, we are moving from our NEET pattern to our new next pattern. So they have given more of the images, more of the integrated question. Even in my ENT workbook, few concepts on the given in the initial pages and few concepts are given on the topic of otology, and they have integrated, and that will be only possible when you will revise it thoroughly. Clear? If the second wire they have asked you beta arrow, more probability they will be asking you electrode array which is going in the scala tympani via round window beta. More probability they must be asking this question. Clear? If they have shown you some other wire which is a ground wire, clear, there is a small wire on the back side, agreed, but I'm not confident what they have asked you in the examination hall. So most of the students were saying the wire which is going into the scala tympani, they have asked you that MCQ. So answer will be electrode array. There was a question on match the following. I am taking you to my workbook, page number 65, where we have discussed this slide. I have shown you this slide. I highlight that there will be MCQ. Same slide given on our workbook, page number 65. This slide is given and they have labeled the structure. Match the following question was there. Clear? So options. Dr. Santosh, was the ground electrode in the option also? They have mentioned there. Did they mention the word ground electrode in the options? Clear? Kindly confirm in the chat box, Veda. Did they mention? This slide, now the slide was of Pinna, and they have labeled the structures A, then they have labeled B, C, and D, and they ask you something on the nerve supply of Pinna. If you remember what we have learned in the class, this is my Pinna. From behind is lesser occipital nerve, medial surface. So a nerve which is coming from behind, that is your lesser occipital nerve. It will be supplying your medial surface of Pinna. The main surface, this segment is supplied by auriculotemporal, and this middle part is supplied by lesser occipital and auricular branch of vagus. So there was a question on nerve supply of Pinna, because some students were saying it was easy to rule out the options if they have asked you something on the match the following question. Clear? Coming on next one, a singer is finding difficulty in raising the pitch on examination, vocal cord adapters. Indirect way of asking which is the main your uh, chief tensor, the main tensor of the vocal cord. Patient, the singer by profession, is finding difficulty in raising the pitch beta. So the slide which they have shown, we have discussed in our DVT, the slide, this kind of slide they have shown you, which is a typical finding of unilateral laryngeal now palsy. So which muscle is, we have two different way to crack this question beta. One is the main tensor. What is the main tensor? Is your cricothyroid. So answer will be your crico. Option A will be the best choice in this MCQ. The second way to crack the same question, this type of appearance is typically seen in unilateral superior laryngeal now. So we'll be going in the favor of your cricothyroid, supplied by external branch of superior laryngeal now. All the muscles supplied by recurrent except cricothyroid. This is second way to crack the same MCQ. Clear? Coming for your upcoming INICT examination beta, always remember two important concepts. In unilateral cases of paralysis, when it is unilateral recurrent or unilateral superior laryngeal now palsy, always remember the patient have a symptom of change in voice. Only hoarseness is there. If there is a hoarseness, change in voice, we will prefer to wait and watch. So it is conservative management. If examiner asks you bilateral recurrent now palsy, both vocal cord will be in the midline. Patient will be having severe dyspnea beta. Just make a concept for the upcoming central examination. And what will be the treatment? Bilateral recurrent now palsy, I have to lateralize. That is your type 2 thyroplasty. Type 2 thyroplasty beta. और क्या पढ़ा हमने? We can go for tracheostomy. I hope you're getting my point. And if in Central Institute examiner asks you something on bilateral superior palsy, both vocal cord will be abducted. So patient will be having a symptom of loss of voice, but more concerned symptom will be aspiration. So what will we be doing? Type 1 thyroplasty. Or for dyspnea, we go for tracheostomy and supraglottoplasties. Clear? So this is the basic funda which you should remember. Why I'm wasting my time on this slide? They can ask you, patient is having some dyspnea after the surgery, head and neck surgery, which complication occurred? Patient have aspiration, which type of complication? They can ask you. They can ask you thyroplasties in upcoming INICT examination. Why I'm repeating this word again and again, INICT, to give one message to my students beta. Those students who could perform well or who couldn't perform well, now forget. Just let us work for the next battle. I hope you're getting my point beta. It is better, okay? Always work on the next segment. Now in upcoming few months we have to appear for INICT exam. Appear beta. Try your best to enter in the Central Institute, and we should learn what are the important errors we have done in the previous exam, which were our weak subjects. I will recommend my all these students make a list. These were the weak subjects I couldn't perform well. Now let's work hard on these things and prepare for the next INICT examination. This is what I will convey the message on this platform. Coming back, they have shown you some this integrated question of ENT with our pathology. They have shown you something on laryngoscopic examination. There is a mass and we have to decide whether it is a benign or malignant, which stain is used. So normally in lectures, the fifth investigation, if you remember the classroom learning, we have discussed IL, DL, video stroboscopy, MRI, and we learn contrast endoscopy. In that I teach you methylene blue, toluidine blue are the chemical which we are using, but those options were not there. But this toluidine blue is a supravital stain, so answer will be, better option will be here, B option. Clear? So answer will be supravital stain. Coming to the next slide, yeah, they have asked lots of MCQs from the topic of nose. Rhinology was there on the normally we expect more MCQs from the ear, but this year they have asked you many MCQs. Workbook page number 33, 2 MCQs from a single slide, single page of the workbook. The first, what we fill in our classroom, nasal polyp with bronchiectasis with dextrocardia, that is Cartagena syndrome. All the students who have attended my lecture, we have filled Cartagena syndrome here, and they have shown you something, a combination slides where they have shown you bronchiectasis, dextrocardia, and diagnosis going in the favor of Cartagena syndrome. Nasal polyps with azoospermia, we have read in the classroom, Young syndrome, and the same slide aspirin semester stride. So if you remember our workbook page number 33, 2 MCQs from a single slide. So high yielding slide of topic of nose, high yielding slide, clear? Either they will give you methylene blue or toluidine blue, beta. Clear? If you open your notes now, we have mentioned methylene toluidine, but instead of that, they have mentioned supravital strain. So they have asked you which is an inappropriate statement regarding semester stride. I always say, okay, they will ask you on something on sensitivity of aspirin. So the option alone was going in the favor of, I don't know the last option, fourth option, but what I have taken the help of the students to recall all the choices. Option A alone, it is not only sensitive to one drug, so that is a false statement. Clear? So this slide, I think this was beneficial for most of the students. Clear? Coming to the next one, question number 14. 20-year-old patient operated with the incision shown in the image. Identify the procedure. I again take you back in my classroom where we have discussed page number 40. We have discussed this slide. And when I was sharing this slide, I still remember one of the students sitting on the front row. He says, sir, we know when we puncture something, fissures, opening, Tommy. When we remove something, it is plasty. And whenever we remove something, it is ectomy, slip of tongue, sorry for that, ectomy. And if we repair something, we use a word, plasty or paxi. So बच्चा ना स्टूडेंट was saying कि सर ये तो हमें पता है why you are making us write in the workbook. मैंने कहा बेटा अगर आपकी बेसिक टर्म स्ट्रॉन्ग है, if you are master of the basic terms, your performance will be on the higher side. I always take my words beta, because most of the medicos are coming from a non-medical background. I always say work hard on the terminology. आपकी बेसिक टर्म स्ट्रॉन्ग है, so you will be on the other side of the game. All the students, page number 40, we have written this point again and again, and we have revised in the class. If we puncture, Tommy. If we remove, ectomy. If we repair, plasty. Now, if I am touching septum, it is septoplasty. If I repair the external nose, it is rhinoplasty. And if we operate both, we call it a septorhinoplasty. You can open, those students who are listening to me for the first time, you can open the workbook and you will realize the importance of basic terms. If we are master of the basic terms, I will be discussing, beta. Dr. Partha will be discussing the glomus tumor, no worries. And the slide which we have given in the workbook, most of the students were telling the same slide was there. Same slide was there. So thanks for all the compliments, beta. Yes, I got more than 100 of the messages on the same day. Yes, sir, notes gold standard. It was best for all the questions from the workbook. And this is a big even motivation for me. Okay, yes, whatever we have given in the workbook, most of the things were there. So when we make our student revise in the class, external nose, rhinoplasty, septum, septoplasty, I hope आपको मेरी आवाज एग्जाम में it must have helped you कि examiner is operating the external nose, it is better to go with a rhinoplasty. SMR is submucous resection, if you remember, incision on both the side. Cordwell luck is on the maxillary sinus. FES, endoscopic surgery, no incision required. So answer will be rhinoplasty. I hope this question was one of the easy, I will not label it as difficult MCQ. Coming on the next slide, 30-year-old pregnant female complaining of hearing loss. There were 2 MCQs actually. In one of the session, they have asked you the diagnosis. So loss at 2000 will go for otosclerosis. Mean years, everybody know we have a rising curve, low frequency hearing loss, low frequency hearing loss. In drug induced, the loss is at 4000 hertz. Clear? And drug induced is noise induced will be 4000. Drug induced will be your high frequency ototoxicity, so base of the cochlear damage. So answer will be here otosclerosis, page number 86. Loss at 2000. I make my student to write the word Carhart notch. Then we have learned Carhart notch again seen in bone conduction. This is something we have ask our students out of 9 graphs which we discuss in pure tone audiometry. Pure tone audiometry, 1 MCQ is always there. 1 MCQ is always there. Is it clear? Is this clear, beta? Then some students were telling me, some students were saying that they have given the same history, same graph was there, and they have asked you the most appropriate sign expected. Most appropriate sign expected. Yes. Now, which sign autosclerosis? I'm taking you back in my classroom, page number 105. We have learned Schwartz sign, red tympanic membrane. If there is a red tympanic membrane, we'll be having Schwartz sign. Schwartz sign positive. Done. So right answer will be here Schwartz sign. Handbird sign. Handbird sign. If you remember where we have discussed handbird sign, beta, where we have discussed handbird sign. True positive. True positive, false positive. Fistula test. True positive, if you remember the flow chart we have made, fistula test. True negative is normal. True positive means fistula present. True false positive, if examiner give you false positive fistula test, false positive fistula test, it is Handbird sign positive. Handbird sign positive. Just give me 1 minute to refresh. Handbird sign positive. Done. What is your Hitzelberger sign? We have discussed in the external auditory canal. 7th nerve. Nerve of Risberg. Nerve of Risberg. Nerve of Risberg. Clear? Loss of sensation in the upper part. So answer will be your Schwartz sign. Just one. Give me. Clear? Is it clear? So answer will be Handbird sign. Very early stage. And what is the beauty for Central Institute? The beauty of this MCQ is they can ask you contraindication of surgery. They can give you a slide of Schwartz sign, red tympanic membrane, and they can ask you it is a contraindication. It is a contraindication of surgery. What will we go for? We'll go for sodium fluoride, NaF. We will go for sodium fluoride. Clear? Now here I can use this MCQ for the upcoming INICT examination. Red tympanic membrane. If they give a history in ENT, this slide is very important. If they give you a history of pregnant female, I will go in the favor of Schwartz sign. If they give a history of high grade fever, it can be cartwheel appearance. It will be red on the whole tympanic membrane. Schwartz sign, reddish hue. In Schwartz sign, reddish HUE, we use a word. There will be reddish hue on one side of tympanic membrane. In cartwheel appearance, it will be the whole tympanic membrane, that is ASOM. Or they can give you a word of pulsatile, that is glomus tumor. So for Central Institute, 3 important diagnoses. One is your Schwartz sign, one is your ASOM, or it can be your glomus tumor. Next MCQ, yes, beta. Dr. Partha, the question comes now. A patient complaining of pulsatile tinnitus, hearing loss, pulsatile word mentioned, I will go for glomus tumor. Now options, the students are giving me 2 options were there. One option was glomus tympanum, one was glomus jugulare. I take you first to my workbook, page number 163. I have given you the same slide, this slide. Can you update in the chat box all the students listening to me? Was this slide was there? This slide was there where there is a loss of a bony partition between carotid and jugular, what we call it as flap sign. I will magnify the slide, beta. Can you update in the chat box? Was the same slide shown? If there is a loss of bony partition between carotid and jugular, flap sign was given. It is more of glomus jugulare. And take my word, whenever they give you the slide, it is a more chances. But if I take with the PYQs, the question is more in the favor of glomus jugulare. But if they have shown you something on tympanic membrane, if they have shown you something on promontory, some mass on the promontory, that is the common site for my glomus tympanum. Kindly update in the chat box. Was the same slide shown in the exam? So we can, because I don't know the actual slide, so just remember if examiner have shown you something on the floor of middle ear and carotid jugular bony partition was damaged, it will be going in the favor of glomus jugulare. Because most of the students were telling me that no flap sign was given, they have not shown any bone loss of bony partition, and if there is some vascular tumor on the promontory, it will be my glomus tympanum. Yes, beta. Sahil, beta, same feedback I'm getting from most of the students. Okay, they have given something on the promontory. So, बच्चा लोग, if they have given you something on the promontory in the middle ear, it is more probability it is glomus tympanum, most common site. Glomus jugular, the most common site is the floor. Rising sun sign can be seen in the glomus tumor. One is brown sign, that is blanching of the tympanic membrane, that all we have discussed in the class. So this is very important topic, beta. Vascular tumors are very important. Angiofibroma, subglottic hemangiomas, glomus tumor, INICT. Be prepared, they will be asking you something related with the jugular. Question number 18. Patient with prolonged intubation complaining of respiratory distress. Study the endoscopic image. Choose the staging used in the suspected diagnosis. This was, yes, beta, the same feedback I'm getting from most of the students. They have shown something on the promontory. So beta, we will go with glomus tympanum. Clear? I'm showing you first slide, page number 178 from my workbook, where we have discussed congenital stenosis. Who are listening to me first time, beta, try to appreciate the beauty of the workbook, where we have writing in the class, we are writing the keyword. Which keyword? Which are the important PYQs? So subglottic stenosis, Cotton-Mayer classification, already we have discussed. In DVT, we have given the same slide. Again, we have repeated subglottic stenosis. So this question, most common stenosis below the vocal cord, most common site, subglottic area. Why I'm teaching with the help of this slide from my workbook, to make you realize the importance of concise notes which we can revise with. Always do those things which are doable, which we can revise multiple times. What is the presentation? It is subglottic area, so it is biphasic dyspnea with normal cry. So what is the concept we have learned? If it is glottic area, the hoarseness, change in voice is there, but in subglottic area there is no change in voice. If you remember, if my word echo in your ear in your examination hall, Cohen's classification is congenital webs, Cotton-Mayer classification, subglottic stenosis. This I repeated multiple times. Cohen's classification for congenital webs, subglottic, Cotton-Mayer classification, less than 50% is grade 1, 51 to 70 grade 2, 71 to 99 grade 4, grade 3 and grade 4 is total blockage. This is what we have studied. Treatment, excision, reanastomosis. Early stage we go for endoscopy, late stage we go for open. We have discussed all these points. So answer, this was the easiest question. It is Cotton-Mayer classification, direct MCQ. Question number 19. Yeah, this question was a tricky integrated question of ENT with ophthalmology. So I discussed with the whole team of ophthalmology what is there. The right answer, 45-year-old female diagnosed with right vestibular neuritis. So if you remember, 2 years back there was a question on this topic of head impulse test, where we have learned, okay, the head movement is to the same side of the involvement. So always remember, it is right side, so head will be turning to the right only, and the nystagmus, the eyeball movement, will be to the left side, to the opposite side. So this was very, I think, integrated question of ENT with your ophthalmology. Question number 20. Patient complaining of chronic nasal obstruction for the last 6 months, operated 2 months back, now with crust and bleeding. This type of history was there. Study the nasal examination. What examiner is showing you? Examiner is showing you a perforation on septum. Clear? Septal perforation. I take you into my workbook again, page number 41. If you remember, I have drawn this line diagram for you. There is an incision on both sides. Can you appreciate, beta? Incision on both sides. We are removing the whole septum because we are giving the incision on both sides. High probability of septal perforation with surgery, SMR, submucous resection. So this was again a direct MCQ from the topic of nose. Examiner have decided to ask many MCQs from the topic of nose, and they have asked you very clinical. Honestly, as a faculty, it was a very conceptual paper. Honestly, it was very conceptual. It was very logical. You apply the logic, you apply the rule out, learn how to rule out the option, you can easily attempt the questions. Clear? But as a student, I agree with you, everyone, okay, it was on the difficult side, because unless you have not revised the things 4 to 5 times, it will not click in the examination. So, but these were the important points. Even then, if you get any other question, you can update me on the Telegram group or on my Insta. You can inbox me. Very best of luck for the upcoming INCT exam, beta, and take my word, divert your energy, channelize your energy to the upcoming examination. It is better not to waste time, better to make a list of our weak areas, work hard on our weak areas, and we will definitely will crack the upcoming Central Institute INCT examination. Best wishes. We stop at this point. Best wish. Any query, feel free to ask me on the Insta. Clear. Thanks a lot.